Welcome to Truckee Talks. I'm your host, Maya Schneider, and it's my great privilege to introduce you to Dr. Jay Foley. Jay, welcome to the show.
Hi, thanks.
And your friend, Jack.
Jack.
It's nice to have you both on the show. Well, Sid, you're here with Jack for a reason. We're here to talk about the pet-assisted therapy programs at Tahoe Forest Hospital and talk a little bit about your work with pets and with patients and how that all ties in together. Tell us a little bit about what pet therapy is and how you got started with that.
Well, pet therapy was started at the hospital a couple of years ago. I was fortunate enough to rescue a dog out of the Placer County shelter, and just a very gentle dog. His name was Sid, and Sid, along with another dog, Dylan, who was one of the nurse's dogs, were the two starting dogs for our pet therapy program. Basically, it's a program that helps have pets visit our hospital, our hospice center, and our extended care unit, so that people who are in the hospital have the ability to have pets and have their lives enlightened by visits from pets.
Now, Sid was a real fixture around the hospital. I remember seeing him a lot. Tell me about the Sid Foley Foundation. How did that get started?
Well, actually, it became a foundation after Sid passed away a couple of years ago. It started when Sid would be going to visit hospice patients, and some of the hospice patients loved this dog so much that they started donating money to him so he could visit other patients, and we didn't know what to do with the money. So what we did is we started a fund, and when Sid passed away, we turned it into a foundation, and it's connected with the pet therapy program, and luckily our pet therapy program is connected with our Humane Society, which has been fantastic in supporting us.
Great. Okay, we're going to get into more details on the pet therapy, but let's talk a little bit about you, your background, how you came to be in Truckee.
Sure. I'm one of the orthopedic surgeons in town. I came here about 6 or 7 years ago. When I first came here, I used to have a great life. As opposed to now. Now I'm a little too busy. I used to come here just for the winters. I'd come here and cover the hospital for the emergency ski trauma. And I'd be here in the winters and Cape Cod in the summers, doing some sailing and travel in spring and fall. It was a great life, but at some point you need to settle down. And I was fortunate enough to have been here for a few years and really settled into the community after that. I'm originally from Massachusetts. I did all my training in Boston, and just so happens I ended up here in California.
Wow, that's great.
Yeah.
You don't talk like you're from Boston.
No, I did my med school in Cincinnati, Ohio.
It all wore off there.
They looked at you funny if you talk like you're from Boston. And sometimes, it's usually when I drink, it comes out.
Oh, good. Well, I'm going to Boston on Saturday. You'll have to give me some pointers.
Okay. Where to park your car.
Right. Exactly. Let's talk about pet therapy. What is that? Do other hospitals do this? Is this a program that you've seen other places?
No, it's pet therapy. There are places nationwide. Other hospitals in the area, even St. Mary's, has a small pet therapy program. Pet therapy has been around for a while. It's been in our community for a few years, and it's really just basic trying to get the patients who have had some physical loss, whether it be health-wise or activity-wise, who are confined to a hospital or an extended care unit where they can't get their own pets to visit, or situations like that, to have them to have visitors. The enlightenment that a pet has can be fantastic, and that's what pet therapy is. It basically is to have pets visit, so these people who have a physical loss literally can have a visit from someone who is gentle and kind and friendly.
Sort of unconditional love is the kind of love
That's the
you
way
get from
pets are.
pets.
They're fantastic, yeah.
You mentioned somebody who's suffered a loss or is suffering a loss. Are there any particular types of patients that are more suited to pet therapy than others? Or?
Well, in our program, we always check with the patient to see if they'd want a pet in their room for a visit. And it's amazing that pretty much anyone in the hospital really wants to see the pet when they come through. The children love it. Certain patients in the ECC have regular visits, and hospice patients are the same way. Everyone seems to have had a cat or a dog at some point, and they all come back with a memory of their pet when you're visiting. It's really kind of a nice memory for them in a tough time.
Now, not just anybody can wander the halls of a hospital. You have to have identification. And
right.
I see you have Sid's old badge
well,
here.
We do have Sid's old badge, and Jack's wearing her badge right now. And it's a pet therapy badge. Whoops.
And she says, well, now that I don't have my badge,
right, she
I
can
can
run
just
away.
take off.
Sorry. I'll stop Jack here.
So Sid had a badge, Jack has her badge. Good to point out now that she's got a badge. Besides the pets, who else is involved with this program? You are, and
I'm one of the physicians involved. Dr. Tim Lombard's now a physician with a pet involved in the program. But there are many other people in the community. We currently have 25 dogs involved in the program. They're owned by pretty much anything, anyone who has a pet that would be a good mix for us. And nurses to anyone, and they basically have to pass a test that we'll talk about, and once they do that and get their certification, they're welcome to come in with certain restrictions.
Well, let's talk a little bit about that. How does a dog qualify for the pet therapy program?
Pretty much the first thing they need to do is really be a quiet dog that really has an ability to kind of sit and wait, wait around a lot. But really the first thing they do is they have to pass the Canine Good Citizen test, which is the American Kennel Club test. In town here it's given by Jeannie Collins, who's a pretty well-known pet trainer, and once a year she gives the pet Canine Good Citizen test to people who are applying to our program, and if you pass, you then have other requirements of passing, make sure the dog's comfortable in the hospital environment. The owner needs to get a TB test. Badges are then given after that. They have a certain requirements that they need to abide by, meaning making sure the patient is willing to have a pet, keeping pet visits to a certain time period. But most of them are pretty mild. Once you pass that canine program, they're eligible to become pet therapy dogs.
Now you mentioned it's pet therapy. Are other kinds of animals welcome in the program?
Cats are welcome. Word is there was in Santa Rosa there was a llama involved, but that was only a rumor.
Reason, Ruth, are you watching?
Don't bring your llamas to the hospital just yet, okay?
Not until we know
Right.
it's a llama therapy program.
Right.
And you said how many dogs now in the program?
I think we have 25.
Wow, that's great. That's great. Who else is involved from a staff level?
From a staff level, the Humane Society is a major involvement with this.
Okay.
The people involved intimately at the hospital, Karen Williams from the floor, she's the nurse manager of the floor. Carol McNamara, one of the nurses on the floor, is very intimately involved. Christine Klett, who works in health promotions, really was literally with my dog Sid, the founder of this program.
Yeah.
I really didn't have the time to do it. She did almost all the work in initiating the program along with Carol McNamara. We have Corinne Wagner, Wendy Culver, both from the hospital. There's numerous people involved.
Sounds like it. It
Yeah.
sounds like it takes an army to keep this thing together.
Yeah, it took a lot to get it together.
Let's talk a little bit about how people get a hold of you. If somebody in the audience is interested in having their pet certified, who should they contact?
Health Promotions.
Okay.
Christine Klett at Health Promotions.
And
would
that
be
number is 582. I want to say
Hope it's on your
It's on
screen.
the screen. It is. Thank you, screen.
I think it's 6504.
It is, or at least if it is on the screen.
Good.
So that's a good sign. Thank you, Mary Lou Sullivan. She's a great producer. Let's talk about the commitment to the program. If somebody wants their pet to be a part of this program, is this something they need to do ongoing? Is it a one-time shot? What should they be looking at?
It's an ongoing thing. It's a commitment. We want the pet therapy volunteer and the pet to make 2 visits per month, whether it be to the inpatient unit, the ECC, or the hospice. And we record them as they come in so we know who is participating in the program, because we do have a dog waiting list, believe it or not, for this. There's other pets that want to be with us. So we want to make sure that the pets are being used and that they're making their visits in their, quote, rounds at the hospital. So.
Well, let's talk about Jack for a minute here.
Sure.
She's here and she's a great dog. What kind of day is a typical day for Jack when she goes to the hospital to visit patients?
I usually bring Jack in on weekends when I go,
Okay.
because during the week I'm just too busy. When I go in on weekends, my rounds in patients are a little bit more leisure.
Mm-hmm.
So I have time to ask the nurses if there are any children on the floor that want to see a pet.
Great.
Occasionally I'll go down to the ECC. Jack really doesn't do hospice because I just don't have the time for it.
Mm-hmm.
Sid did a lot of hospice work, though.
Sid seemed to be everywhere. He was sort of the omnipresent pet therapy
Sid was
dog.
everywhere, yes.
He
yeah.
was. And
Looking for food, I
well,
must
for
say.
the longest time, I thought Sid was Christine Klett's dog.
Yeah.
They were sort of inseparable. Let's talk about the Sid Foley Remembrance Walk. What
Yeah.
is that?
Well, Sid passed away last May, and we never really got a chance to say goodbye to Sid. So last October, we decided to, Christine and the people in the foundation decided to have a walk. And basically, the memory walk is not a memory of Sid. It's a memory of those pets in our lives who meant something to us as individuals in our community. Anyone is open to come to it. It's not a pet therapy walk. It's the proceeds from it go to the Pet Therapy Foundation. This year, the proceeds from the walk are going not only to the foundation, but to the Tahoe Forest Hospital Cancer Program and the Humane Society. So the proceeds from the walk go to different areas in our community. But this walk is open to anyone who loves pets, loves dogs, and really wants to come out and visit with other people who love the same thing.
Now, I'm assuming that a lot of people on this walk will be bringing their pets.
They bring their pets, yeah. We provide pooper scoopers, dog cookies, and we want you to bring your pet.
Okay, what about cat treats now? We got to bring the cat treats.
This is more of a dog. If your dog socializes well with cats, then you can bring them. This is really a socialization event for dogs.
Okay.
Yeah.
So it will be held in the Martis Valley Wildlife Viewing Area, and that's off of 267.
Correct.
And that's on the west side.
On the west side,
On the
airport
west
side.
Right.
Yeah.
Okay. Saturday, October 12th, and you're starting at 1 p.m. So should everybody just show up at 1, or should they call ahead
They
of
show
time?
up, no, they register right there.
Okay.
They can call ahead to inquire about details, but they can register right there.
So again, the Sid Foley Foundation presenting a memory walk Saturday, October 12th at the Martis Valley Wildlife Viewing Area. It starts at 1 p.m. Just show up at 1 p.m. and commemorative T-shirts will be available, and that's part of the fundraising. And you can call 582-6504 for more information or to order your T-shirt ahead of time.
Right.
It's great to have that, and great that you're assisting so many different programs there. That's a wonderful thing.
Right, it is, yeah.
How many people are you thinking you'll see on this walk?
I wish I knew.
How many dogs, right?
right.
Exactly. Tell me a story. You told our producer that your father died 2 days after Sid.
Right. When Sid passed away, it was pretty devastating to a lot of people, myself obviously included. And I never really got a chance to say goodbye to Sid because my dad passed away 2 days later, and I basically had a chance to bury Sid, but we were going to have a remembrance party literally the day I had to fly out to see my dad. So, you know, my thoughts on this, it's kind of difficult. Sid knew my dad, and my dad thought it was the greatest thing. My dad would send Charles Kuralt letters about this pet therapy program dog to have a Charles Kuralt travel talk on it. Anyways, my thought is that somehow Sid knew. Sid knew something was going on, and when Sid passed away, he was somewhere else waiting for my dad.
Yeah, yeah. And they're together now, and that's a pretty cool thing. Nobody should have
Thank you.
that much loss all at one time.
That was hard.
Tell us about some of the good things you've seen with pet therapy. Tell us some of the good stories.
I think some of the good stories that I see, since I'm able to I just bring my dogs to the floor, are that literally everyone has a pet story. They all tell you about their pets. They all say their pet is the greatest pet in the world. And when the pet comes in, the children love it, but it doesn't have to be young and old. It can be any age, because as you know, here we get a lot of younger people with ski injuries going through the hospital, and they all just think it's the greatest thing. You know, I don't think pet therapy really exists in the Bay Area as much as it does other places, because a lot of these people, this is their first experience with pet therapy, and they really think it's the greatest thing.
Yeah. So you just pretty much unanimous great support for it.
Yes, really. I have not had any patients turn me away.
We talked a little bit about which dogs might be appropriate for the program and which patients. But what about the dog's family? Which dog owners or which cat owners are better suited for this kind of program than others? What kind of temperance do you look for?
You know, I think that comes from within. I think a lot of the people who are involved in the program actually have had experiences at the hospital. And our hospital is a great hospital. They come in and they see other dogs involved, or they hear about the program through the Humane Society, and they have time to commit to the program. And they know that they have a good pet that makes people happy. And those are the type of people that we have initially started our program with, and those are the type of people we seem to have. And I don't even know half of the people in the program, or half the pets. I just like looking at the pictures which are hanging on the floor.
Now, so you can find those pet therapy pictures if you were visiting Tahoe Forest Hospital?
If you're visiting the inpatient floor at Tahoe Forest Hospital, the pet therapy pictures are all there.
Yeah, they're right by the North Station, I believe. Yeah, the nurses' station. You can go find a lot of cool pictures there. What's next for pet-assisted therapy? If you had a goal to put out there, or some future vision for the program, it looks like it's gotten bigger than something you could have imagined all by yourself.
It has blossomed quickly, which is great. I think just the welcoming of the community has been tremendous. In the hospital, in the Humane Society, I don't know.
Well, Jack, what do you think?
What do you think, Jack?
She says, if there's steak in it for me,
pretty
much I'm there.
Pretty much, yeah.
No, well, okay, so now that begs another question. What do the pets in the pet-assisted therapy program think about hospital food?
They love it. Yeah, it's still the #1 concern of every pet that comes in is what's left over from the patient's tray.
What's to eat?
Yeah.
And actually, with a nod to our dietary department, the Tahoe Forest Hospital does put out good food.
They put out excellent food.
Never mind that airline food or hospital food. The Humane Society you also mentioned, Jay, has a pretty significant role in this. What is their role in the pet-assisted therapy? Are there foster dogs that they bring in?
I think our program was not able to be started without... Come here.
Come on, Jack.
Get over here. Sit down.
Oh, sure. On my time.
Our program was not able to be started without the Humane Society's backing. I think most of the pet therapy programs really are dependent upon the Humane Societies in their local community. And with that, it's simply their backing that has been beneficial. And we try and help them with some of our foundation will occasionally help them out, but for the most part, I mean, they help us. And where they're going to go with us, we're not sure, but we hope that we continue our relationship with them.
Yeah, it sounds like it's a great, all the way around, a great relationship. Hello, Jack.
Once again, Jack's tying us up here.
That's right. Yeah, things could get a little kinky here on the set of Truckee Talks rapidly. Well, I would say this is something you couldn't do with Sid, was sort of manage.
Sid was a 100-pounder, yeah.
Sid was a big dog. Well, again, it's a good time to remind people of the memory walk from the Sid Foley Foundation. Will be Saturday, October 12th. It'll be at the Martis Valley Wildlife Viewing Area. It starts at 1 o'clock on that day. You can just drive on out to the Wildlife Viewing Area, but if you'd like information ahead of time, the number is 582-6504, and that's a good number to call for any information on the pet-assisted therapy program. If you would like to volunteer, if you have a pet that you think would be an ideal candidate, Well, we'll find out, and it would be a great way to get involved and help patients feel better, I
Yep.
think. All right. Jay, I want to thank you so much for being on the show.
Yeah, thank you.
Yeah.
I'd like to thank all those involved with the PET program, and thank you for having me.
You bet. Jack, thanks for coming on the show. It's been great having you here. And Jay, we'll see you again. Thank you so much.
Thank you.
All right, we'll be back in just a minute with upcoming events, so stay tuned. Well, welcome back to the show. Jack and I are here to give you the rundown on upcoming events. October 4th through the 6th is the 17th annual Tahoe Donner International Wheelchair Tennis Sectional Championship. This event is free and open to the public. Come on out to Tahoe Donner and watch these athletes in action. October 5th and 6th is the 10th annual Donner Party Hike. Guided hikes along the immigrant trails will highlight points of interest. On the 5th, a community social will be held starting at 6:30 p.m. I guess since it's the Donner Party, they don't call it dinner. Saturday hikers sign up at Donner Ski Ranch, and Sunday hikers sign up at the Donner Camp Picnic Area on Highway 89 North. Call the Truckee Donner Chamber of Commerce for more information at 587-2757. Also on October 5th and 6th is North Star at Tahoe's Dirt Camp. This is 2 days of mountain bike instruction by professional racers, bike manufacturers, and physicians. The cost of the camp includes 2 days of instructions and bike lift tickets. Call 1-800-711-3478 for more information. On the 6th, the Humane Society, Jack, brings their 4th annual Shack Scramble to the Tahoe Donner Golf Course. Call the Humane Society for more details at 587-5948. And October 8th, the Truckee Donner Historical Society is presenting a living history program at Donner State Park. For a mere $3 donation, you can see Fred Horlacher portray Moses Schallenberger, who survived the winter of 1844-1845 in a makeshift cabin at Donner Lake. It begins at 6:30 p.m. and light refreshments will be served. That's it for this week. We want to thank Dr. Jay Foley and Jack for being on our show, and we'll see you next week.